Hello, my name's Bronwyn. I'm one of the improvement facilitators for PACOP, and I'm here to talk to you about the symptom assessment scale for care workers, looking at distress from pain in dementia. There are over 100 different types of dementia. We talk about stages of dementia being mild, moderate, or severe. What's important to remember is that each person will experience their dementia illness in a different way, often because of the backgrounds that they come from and the experiences that they've had during their lives. So it's important for us to remember that even when someone is at end stage of illness, they may still be able to help us work out why they're in pain. Some people may still understand what pain is and may be able to tell you about how much the pain is distressing them. Other people may no longer understand the questions you're asking them and may also not be able to respond. When this happens, it may seem to make it impossible then to try and work out if someone's in pain and how much it distresses them, particularly when they're no longer able to tell us that they are. What we do know, however, is that in your roles as care workers, you have the best knowledge of your residents. You know them, you know their daily routines, you know their histories, you know their likes and their dislikes. How many times have you said to yourself and your co-workers or your RNs and ENs that your resident just doesn't seem to be themselves today? This is how your knowledge of the resident is able to help us work out what's happening to the resident when they're not their usual selves, and gives us an opportunity to begin to investigate how much pain is happening to the resident and how much it's distressing them. The Symptom Assessment Scale, or the SAS, is one of 6 tools that we use in PACOP to work out what is happening to a resident from a palliative care perspective. In this case, using the symptom assessment scale with someone living with dementia helps us to work out how distressed a resident is from the pain that they may be experiencing. It's not a pain severity scale, so it's important to distinguish the difference between those. You have other tools that you may use to work out what the resident's pain severity is. This is looking at the impact that the pain has on the resident, how it's stopping them from doing the things that they would like to do, activities, getting to the bathroom, getting to the dining room to have a meal, socializing with people, being able to spend time comfortably with family and friends. So what we're looking at here is distress rather than severity. We have tools and resources to help you get the right SAS scores for someone who's living with dementia who may have distress from pain. For some residents with early or moderate dementia, we can still ask them about how much their pain bothers them. There's information that you can give to them and to their families or carers to read about how the SAS works. This gives the resident the best opportunity to tell you themselves, which is the gold standard. If they're not able to do it entirely on their own, often families can assist with this. For residents who have more advanced symptoms of dementia and who no longer can understand the questions you're asking, we have information about how to communicate with them and how to ask the right questions to find out how much pain may be distressing or bothering them. There are different sized rulers that can be used for people to be able to indicate the level of distress that they're experiencing. If your resident is no longer able to understand you when you ask questions about how much pain may be bothering or distressing them, there is a guide to help you make a decision on their behalf. Whenever you make a decision on behalf of someone, it's called making a proxy decision or being a proxy for someone. So tips to be able to do a good proxy score for someone who's living with dementia and who may have distress from pain includes something like asking yourself, is this resident different today? If you know what their usual self is, the questions that you'll be looking at are they more or less active than usual? If you don't know the resident, then perhaps ask someone who does, a family member, a friend of theirs, or a co-worker. Whenever you score a proxy score, you have to score it from the resident's perspective, from the resident's point of view. It's almost as though you become the resident. Score while you're providing care. There's no point scoring a resident who's at rest. Most times when people are at rest, they don't demonstrate any distress from pain. The distress comes from when they're moved. So provide the score when you've actually moved the resident. Notice what their body language does. Do they have non-verbal clues? Consider their voice tone. Consider the pitch of their voice. If you have a look at this list below here, there are some traffic lights here. There's green, orange, and red, and you'll see there's a SAS score guide. There's some language here, or there's some descriptors here that help you to read through and identify what level you think that the resident's distress may be at. So having followed the prompts above, you go to this list below and you have a look at the descriptors. And from this, it may assist you in being able to do a score for the resident. Some aged care homes are using the Pain Check app. This takes a video of the resident's face and helps to identify microfacial expressions of pain. This app also uses aspects of the ABI pain scale to confirm the information that the app collects and interprets when it takes the video. The important information here is how Pain Check total scores work with the SAS. So what you'll see here is that the Pain Check actually measures or assesses the severity of the pain of a resident. And then you'll see in the middle column, there's your SAS score. Your SAS score is about the distress that the resident experiences from the pain. And then you'll see in the third column, there's a PACOP action plan. So if we look at, for example, the Pain Check score of 16, it then lines up with severe distress score of 8 in the SAS. Whenever you have any kind of severe symptoms, the escalation process is to report this to an RN or supervisor immediately. Similarly, if you're looking at a score of, say, 12 in the Pain Check score, it lines up with moderate distress and a score of 4 in the distress scale, the symptom assessment scale. The instructions that you have there is to report to the RN or supervisor within half an hour. The Pain Check score of, say, 7 lines up with mild distress score of 1 in the symptom assessment scale, and the instructions there are to report to the RN or supervisor within the shift. If your aged care home is using the ABI pain scale, have a look here at how the total score may help you to identify the degree of possible distress that your resident may be experiencing. So on the left-hand side, you've got the ABI pain scale scores. In the middle, you've got the SAS assessment scores. And there on the right-hand side, you've got the PACOP action plan. So for an example, if you've got a ABI pain scale total score of 3 to 4, this would probably be similar to the resident experiencing mild distress from their pain. And if that was to be the case, the action plan or the escalation process for that would be to make sure that your RN or supervisor knew that within the shift. In the next level there, in the orange section, if your ABI pain scale total score was 12, this would line up approximately with a score of 6 in the symptom assessment scale, which would indicate moderate distress. And if a resident is experiencing moderate distress from pain, then what we'd be looking at is escalating this to the RN or supervisor within 30 minutes. If the resident was experiencing any of these scores from the ABI pain scale in the red section, you can see how they would line up with scores of 8, 9, or 10 in the symptom assessment scale. And the action plan or the escalation process for that would be to report that to the RN or supervisor immediately. And they would need to take action around what intervention they would have to do for this particular resident. Another pain severity assessment tool that could be being used in your aged care home is the PAINAD. This tool was specifically developed for pain assessment in advanced dementia. All of these tools look at the nonverbal cueing, the mobility of the resident, how much pain they have on movement, and this is how the PAINAD is able to determine the severity of pain in someone living with dementia. Now, the PAINAD looks at severity of pain. The symptom assessment score, however, looks at the distress that may cause the resident. So if a resident has pain of 9 out of 10, you would expect them to be calling out, not walking properly, not being able to get to a dining room, maybe lying in the bed the whole time, maybe rocking, lots of verbal sounds, vocalizations. So the PAINAD score of a 9, severity of 9, would have quite a high level of distress potentially for the resident, which you can see in the symptom assessment score of 9. And this has an action of reporting this immediately to your RN or supervisor, whose role it would be to escalate this to a GP for immediate intervention. Similarly, if you've got a score of 4 perhaps in the PANAD, this may equate to a level of distress that the resident would be experiencing from this symptom of a 4 or a 5, and the expectation is that you would report this to your RN or supervisor within 30 minutes. If a resident was in the green zone, scores of pain of 1, 2, or 3, this may line up to distress around 1, 2, or 3 for the resident around this symptom. And the escalation process for this would be to report to your RN or supervisor within the shift. Having done all the amazing work that you do, finding out what is happening to your resident and working out that they've got pain, the important things to do there are now to record the information, to make sure that you're using the escalation ruler below, and to report to your supervisor or your RN depending on the degree of distress that the resident is experiencing from the symptoms. So thank you for watching this clinical bite. This is part of a series for the care workers around using the symptom assessment scale. For more detailed information on all of our assessment tools, ask your local PACOP contact or send us an email at pacop@uow.edu.au.